Sciatica, right? Sciatic nerve, sciatica.
Yeah.
That's when you got radiation of pain down the leg.
Yes.
Kind of feel in the back, and then boom, it's starting to shoot down your leg. True sciatica is when you have a nerve in your back compressed, and then it goes down into your glutes and goes down into your leg, right? Sciatica can come about from a few different ways. Like I said, most time a nerve gets compressed in your back. If you're between the ages of 30 and 50, 30 and let's say 30 and 60, the most common cause of true sciatica, and I'll say what I mean by true sciatica after, is a disc herniation. So that disc pops out, it compresses on the nerve, and it's starting to send pain down the leg, right? And pops out is not the right term, but you know what I mean. It comes out.
Herniated.
It slips out,
Yeah.
starts pressing on some nerves, causes irritation. The reason why I keep saying true sciatica is because people can get sciatica-like symptoms that is not actually a nerve or a disc herniation. You can get something called piriformis syndrome. What that is there's a muscle in your glute called your piriformis. It's an external rotator of your hip. When it tightens, it sits on top of the sciatic nerve. So when it gets tight and compressed, it can start to push on that sciatic nerve, and then that sciatic nerve will send the pain down the leg.
So how do you, at home, how would you get rid of that?
Well, it depends on if it's true sciatica or if it's piriformis syndrome.
That one, the muscle one.
The muscle one. So foam rolling on the glute.
Foam rolling,
1,000%.
On the glute.
On the glute.
Okay.
Foam rolling on the glute.
Not actually in the back where the pain is coming from.
So
right on the glute.
if you have true sciatica, it's much more complicated.
But how can you tell which one is which?
You have to go in and get it.
Oh,
yeah.
okay.
Even me, sometimes you have to you take someone through a serious neurological and physical exam to tell them like, okay, you have a herniated disc or you've got piriformis syndrome. Another thing that can cause sciatic-like symptoms is joint dysfunction. So just meaning improper motion in your joint, in your sacroiliac joint, which is also in your low back right above your glute.
Okay.
Well, if it's a muscle and it's tightened up, eventually after a few days, when it loosens up, you should technically no longer feel that pain, right? And that's kind of how you know maybe it's not a herniated disc, right?
Yes, so exactly.
Because a herniated disc is going to be painful, I think, all the time. It never goes away, right?
All the time, yeah.
So the foam roller will be option number one.
Foam roller would be option number one. You're like, ooh, I'm having pain down the legs, kind of starting in my low back, but I feel it in my glute. Let me roll out my glutes.
So what are you actually doing? Trying to rolling out some of your muscles with a foam roller, right?
Foam roller, yep.
Loosening it up and
exactly loosening it up. Gotcha. You're trying to get any knots out of there. You're trying to take some pressure off that sciatic nerve that could be causing the sciatic-like symptoms.